My name is Dr. Ahmed, one of the surgical doctor. How are you been? How are you been recently?
Not good, doctor.
I'm sorry to hear that. Mr. Edward. During your last days, during the last days of your hospital stay, do you felt down or depressed or hopeless?
Yes, doctor. I feel depressed all the time.
Mr. Edward, do you feel that you are no longer enjoying life?
Yes, doctor.
You found the life is you found no pleasure in life. Okay. Now, Mr. Edward, do you feel overly tired?
Exhausted, actually, doctor. It's been hard to get through the day, doctor.
I'm sorry to hear that, Mr. Edward. Now, Mr. Edward, is your mood is varied during the day?
Yes.
Okay. Is there any particular time during the day is your mood is changed?
Yes, doctor. Morning are usually the tough time for me.
Morning. Is okay, Mr. Edward. Is your mood okay, Mr. Edward? Do you have any change in your sleep pattern?
Yeah, I am struggling to fall asleep, doctor. And then I wake up early.
When you wake up early, do you find that difficult to get back to sleep?
Yes.
Sorry for that, Mr. Edward. Okay. Now, do you have any change in your appetite?
Yeah, I have been eating a lot less than usual.
Okay. What is your type of diet now?
I eat a little of vegetables and some bread.
What are you normally eating?
In the past, I was eating some meats and some fish and some chickens.
Okay, Mr. Edward, there is any change in your libido?
Yeah,
Okay. Do you find there is no pressure in your sexual relationship recently?
yes.
Okay, I'm sorry for that, Mr. Edward. Do you have ever experienced this, like this feeling before?
Yeah, I had some episodes.
Are you counseled for this before? Counsel for it before?
Yeah, I had counseling before, but it didn't seem to help me.
Now, Mr. Edward, are you ever admitted to the hospital because of mental issue?
No, never.
Never. Now, Mr. Edward. Now, Mr. Edward, do you have any mental issue?
No.
Okay. Okay, Mr. Edward. Okay, Mr. Edward. Okay. I present Mr. Edward. Mr. Edward, who okay, present Mr. Edward, who came with the signs of major depressive disorder. There is the sign of major depressive disorder. There is that's increase at morning. There is alhedonia and low and low appetite, loss of libido, and altered sleep pattern. And he has a past medical history of the same that he counseling for it, and he never admitted for hospitals for mental. So my main differential diagnosis is major depressive disorder.
Okay, how are you going to approach this patient?
Okay, our approach these patients firstly I will do after doing full clinical examinations, I will do blood investigations like CBC, comprehensive metabolic panel, thyroid function test, and thyroid function test. I will refer it for psychiatrist evaluations in case of severe to exclude the severe psychiatric problems. Also, I will do imaging like CT, MRI for brain to exclude the structural abnormalities, and imaging also. According to treatments, I will treat these patients according in the MDT meeting. In the MDT meeting for mild symptoms, advice for regular exercise, dietary controls, and cognitive behavioral therapy. For severe symptoms, I will do for regular exercise, advice for regular diets and cognitive behavioral therapy, and also I will consider medication like SSRI, medication like SSRI, and also in severe case I will admit it to psychiatric ward.
Okay, could you give me an example for SSRIs?
Sertraline or something like that.
Sorry?
I'm not sure about it. Sertraline or...
Okay. Will you consider admission for psychiatric wards?
As I said, I consider admission for psychiatric ward in case of severe. Okay.
Okay. He still have time?
Yeah, بس باقي له دقيقة.
Okay, I would like forget حاجة ولا...
Okay, is there any question you would like to ask this patient about?
تفضل.
Okay, I want to ask the patients about
Okay, that's fine. You can go to the next station.
Okay. طب حاجة ولا شنو زمان ده كتير؟
Well done.
ها؟
The station is short station. Okay. You did well.
بص أنا ذكرت طابس شنو زي.
What?
قلت لك ذكرت طابس شنو.
What did you miss?
Do you feel that you want to harm anyone or harm yourself?
Excellent.
وبعدين differential diagnosis. I want to say my differential diagnosis. Beside major depressive disorder, I have anxiety, bipolar, schizophrenia, drug-related.
Excellent. It's very important to ask about how do you think about harm yourself or anyone else?
Suicidal ideation هذه مهمة جدا.
Yeah.
Because this if it is positive or present, so you will consider admission to psychiatric ward directly. Okay.
لا دي كانت الطبزة هنا.
هسه يا ابراهيم لو الحاجة دي جاب عليه بوزيتيف أنا في المانجمنت أنا المفروض أقول الزول ده دايركت كده المفروض طوال أدميشن صح؟
Yes, psychiatric consultation considering refer to psychiatric ward for admission. As a patient have a suicidal ideation. Okay. Overall, I think you did well. Do you have any comment, Ahmed or Abu Talib?
أنا عندي كومنت على سؤال سأله ما يعني حسيته غلط يعني.
تعرف شنو؟
السؤال بتاع did you diagnose any mental issues؟
يا خدتنا لكن سخطوا انا ذاتي حسي بيها كده.
يقاتلنا، لكن السؤال يعني صيغته ما كده. يعني السؤال بيقول لك have you ever been hospitalized to the hospital due to mental health. السؤال الثاني الكونسلنج، انا ما عارف انت سالته ولا سالته للمنتال هيلث.
سألت
الكونسلنج ده
ما سألتك قلت لك بمعنى انه انت قلت لي قلت لك عملت كونسلنج، كان سألتك من الكونسلنج، لكن للاسف السؤال موجود have you
هو
have
الكونسلنج ده
any problem with
الكونسلنج ده لاني ايشوز. عرفتها؟ الكونسلنج ما للمنتال هيلث، لاني ايشوز ثانيه.
any issues before.
بعدين في السمري ما ذكرت انه انا عندي بريفيوس ايبيسودز.
ذكرتها
ذكرتها في السمري.
ذكرتها وانت معنا.
قلت انا انتبهت معلش.
Okay, about the past psychiatric history, there's two different questions. The first question, have you diagnosed by any psychiatric illness or mental illness? This is a separate question because some people diagnose and they will not be admitted to the hospital because of this. They just take their pills and take their and getting counsel and all the management without admission. So this is a valid question. And the other question is different question. Have you admitted before? So you have to ask about both of them, especially you have a lot of time. Okay.
اوكي.
السؤال يا ابراهيم يعني اساسي ذاكرين سؤالين. انا ما اعرف منير، انت لو ذكرته قول لي، لو ما ذكرته اتذكره يعني. اللي هو بتاع have you ever had any other periods of feeling particularly low. السؤال اللي فوقه اللي هو have you ever experienced this episode before. يعني انا اعرف الفرق بين هذا شنو.
انا والله انا حسيت بالتكرار، فهمت الفكره؟
يعني انا زي حسيت انه هنا بيسال من symptoms وهنا بيسال من diagnosis عديل. يعني
انا سالت بين انه نفس الشعور بيفور، وسالت من الادميشن have you ever had يعني have you ever admitted to hospital because of mental issue، وانه experience this before.
طيب انا لما قلت لك انا لما لدي انا ما قلت لك صح.
هو انت لو قلت have you ever felt like this before دي will be cover يعني. felt like this هو you mean felt depressed or low, same symptoms.
أنا في البيولوجيكال symptoms of depression يعني السليب ده ممكن أكتفي بسؤالين بس. يعني what about your sleep? Do you have any change in your sleep pattern أو any difficulty in getting sleep؟ وخلاص يعني ما أسأله do you wake up early and find it difficult to go back again وكده. والابيتايت برضه what about your appetite? Do you notice any change in your appetite recently؟ لكن أسأله أقول له يعني what is your appetite like at moment؟ حاسس يعني زي اللي بكرر في نفس الحتة تاني، ولا رأيك شنو؟
والله I think it's better to ask about it, especially in the mood, because the patient will usually be positive for this, and also you have a lot of time in depression.
لا في المود المود بيختلف يعني.
it is very short station. And another thing, the patient will give you short answer. If he make him seem like depressed or something like that, he will not give you long sentence, or he will not express himself. He will just give you short answer. So I think it is fine to ask all the questions to elaborate more about the mood of the patient or the sleep of the patient also. The same for sleep. For appetite, I think it's fine to ask it about have you noticed any change in your appetite.
Okay. وفور libido برضه أسأل.
Say yes, you just maybe you want to know that he's eating less or have less appetite.
Okay. Regarding a libido, well, since you have feeling this way, do you notice any change in your sexual drive? فرق شنو مما أقول له do you notice any change in your libido?
Well, for me is the same. For me, the same. So this is a repeated question for me. You just ask one of them. Since you have been feeling this way, have you noticed any difference in your sexual drive? Then he will answer you yes or no according to this. I think it's better to
وانا
ask just
ممكن
one of them.
انا
Or
ممكن ذاته يعني شنو يعني زي ما بيقولوا رب ضارة نافع. انا ممكن اقول له يعني كده، ممكن هو لو يقول له I told you doctor no، اقول له I'm sorry I'm just want to confirm او I'm just want to be sure. طب قال لنا درجة بتاعت بروفيشناليزم برضه بتاعت communication. هو ما في حاجة، الأسئلة بسيطة.
يعني قصدك intent انه تعيده تاني يعني؟
يعني السؤال بتاع الليبيدو ده مثلا do you notice any change in your libido؟ أنا أجي أسأله since you ما عارف feeling this way. لو هو استدرك وقال لي يا أخي أنت سألتني السؤال ده، أقول له يا أخي I'm so sorry I just want to be يعني sure.
ما هو المشكلة ان الاكزامينر يحس انك بتسأل نفس السؤال او تسأل بنفس الايديا. عرفتها؟
انا بحس انه هذه في الاسئله الموجوده موجوده عندنا دي في كم سؤال ورا بعض بتحايم في نفس الايديا او بيكرر نفس السؤال.
فأحسن شايف تسأل سؤال واحد اللي هو since I've been feeling this way have you noticed any difference in your sexual drive or any change in your sexual drive? I think it would be better. بعدين هو موضوع الزمن ده عادي يعني عادي انك تخلط قبل الزمن، ما هو مشكلة. فانت ما تحاول تملى حتى لو بحاجة انك ممكن تكون ريسكي عليك في الفورم تستخدم. عرفتها؟
لا السؤال طيب يا ابراهيم، هو بيسمح لي بان انا ابدا السمري قبل 5 دقائق تنتهي او 6 دقائق؟
Yes, for sure. If you finish in 4 minutes, you can just start your summary directly when you finish. So no
طيب
problem.
انت بعد خلصت معاه الدسكشن قلت له يا اخي is there any question do you want to ask؟ دي في chance لحاجه زي دي ان انا بعد اعمل سمري وكده استدرك اسئله واجي اقول له يا اخي لا انا عايز اقول كده وكده؟
To ask the patient after the summary? No, you can't ask the patient. When you start the summarization and presenting your case and discussion, I don't think you can ask the patient a question.
طيب كويس.
Excellent يا أحمد. ما عندك حاجة بالدiscussion. It's fine. في السمري okay, based and present with the symptoms not signs. It's better to say symptoms, Ahmed. Symptoms suggesting for major depression disorder include blah 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 blah. Okay. You start. I will do full clinical examination. In this, you can say that the full clinical examination and review the patient history. Okay.
And review the patient's history.
Medical history, yes. Because this is atypical history. You take history about the patient mood, you assess the patient mood, okay? But you didn't ask details about the medical history. So you will review the medical history of the patient because the patient is admitted and have surgeries and he have a cancer, okay? You will review that and review the medical, the medication. If you say this will be, I think, something good. Review the clinical examination and review the patient history.
Okay.
And then
any sign of underlying medical conditions? Huh?
Yes. Then you think you will do the blood test. That is very good, and you start to elaborate the test you will do. I think it is better after the blood test to speak about the image study, because the blood test and the image study, the aim of them is to exclude the medical codes. So it's look nice if you mention I would like to do blood test include and imaging study include blah 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 to exclude any medical causes Then I would like to do psychiatric evaluation. You will look more organized if you bring it like that. Okay. MDT, it's better to say multidisciplinary team. It will be more fun, it's be better to say multidisciplinary team. SSRIs, this will be better to say selective serotonin reuptake inhibitors. Otherwise, I think you did excellent.